Good morning. Hi, everybody. This is Monique with the Epilepsy Foundation. I'm just going to make sure the sound works because y'all know that when I do a stream, there's always going to be some sort of sound problem because of my crappy computer. Lakeisha gets it. Wait, look, can you make sure that I'm pronouncing that correctly?
Lisa, it's okay. It's okay.
Okay, Laquisa. Okay, good. Oh, yeah. And the sound looks like it's working, so I think we're good to go. But thank you all for joining us this morning. I see some people trickling in, which is awesome. Again, I'm Monique from Stream for Epilepsy. You guys know I'm wearing my flame hat, which means that we're talking about epilepsy this morning. And so today I have the privilege of LaQuisa joining me from the Epilepsy Foundation. We were just chatting about how normally she's in the background and how today she is at the forefront of the conversation because we really wanted to bring her here to you guys so that we could talk more about Seizure First Aid, some of our other health programs and services that we offer at the Epilepsy Foundation, and basically where your dollars are going when you're charity streaming for us, when you're raising awareness, where that all goes to. As a reminder, this is day 4 of National Epilepsy Awareness Month. November is a big month for the Epilepsy Foundation and our community nationwide, the 3.4 million Americans that have epilepsy in America alone. Um, and a part of National Epilepsy Awareness Month is our Game Over Epilepsy event. For those of you in the chat, I would love to update you that we have raised over $4,000 already this month of November. It's really incredible. We actually just had somebody else wrap up a stream in Japan. He was doing a 12-hour charity stream overnight for us, but during the day for him in Japan, he was able to raise over $400, actually $500 for the foundation, which is awesome. And he's actually our only D live streamer, so wasn't even on Twitch. So it was a really cool way to reach a different community. So thank you all for all that you're doing to support us this month in November and beyond. As a reminder, you can always find more information about upcoming streams and whatnot on our socials as well as in our Discord. Um, I always forget the command for social, if it's socials or social. So we got our socials up there, so I encourage you all to follow, retweet, keep spreading the word for all the people that need it in the epilepsy community. So my spiel done. LaQuisa, I would love for you to introduce yourself and tell us a little bit more about what you do here at the Epilepsy Foundation.
Yes. Hi, everyone. I am super excited to be here and this on this platform. This is a new platform for me to be speaking on, and just thank you, Monique, for all that you're doing to make sure we're reaching people in their environment. You know what we say in public health, where people live, work, and play, worship, right? And so, yes, this is definitely a great avenue to reach people. And so, I'm LaQuesia Haynes-Smith, and I am the Senior Director of Training at the Epilepsy Foundation on our Public Health and Education team. And we sit within the Mission Outcomes Department. And I have the privilege of helping to develop and manage education and training programs that help to keep 3.4 million people in the US safe, 3.1 million people with epilepsy in the US safe. So I provide leadership and oversight and strategic planning for those public health and education programs. So when you think of a training that you might take or a course that you might take or some other more formal educational activity, I might have my hands in it a little bit. We do a lot of education at the foundation through different formats like this. I'm not involved in all of them, but the ones that are more tied to public health and the work that we do with the CDC, those are the ones that I'm responsible for.
It's no small feat, you guys. So I just put some links in the chat. This is where you can find some kind of on-demand training, other educational videos. LaQuisa plays a big part in all of that in the way that we're able to educate educators, first responders, what have you. We are on the front lines teaching for seizure first aid and other methods to make sure that our community is being served where they are, like LaQuisa said. So thank you for sharing that little tidbit about yourself. How long have you been working in the public health space?
Ooh, now I'm gonna feel a little bit old, right? Because I was like, wow. So I graduated from college in 2002, And I had the introduction, when I graduated from college, working in a nonprofit organization, an aid serving organization, so
Oh,
another.
great.
And so that was my introduction into public health, HIV prevention, other chronic diseases back in 2002. And then I earned a master's degree in 2007 with a master's in public health. I mean, I'm sorry, in health education. And then I worked in academia, but still working, in the public health space. And I became a master certified health education specialist, and we call them CHES or MCHES.
Okay.
Around 2012. So I've been in the space for a while. I've been blessed and been able to work on different chronic disease programs such as, like I said, HIV and AIDS, now epilepsy. But I also worked on more systems work, looking at developing programs so we can look at policy systems and environmental change to help prevent and manage chronic diseases in general. So
Right. Yeah, so just a little bit. You just have a little bit of experience.
just a little bit. So I've worked for the foundation for only 3 years, and I will
Really?
say, yeah, only three
I feel
years.
like
I've
you've
done
been
a
here
lot.
longer. Wow.
I feel like I've been as much work, that
We've
we've been
aged.
doing. Yeah. And it's interesting because I didn't know a lot about, even being, a health educator, being in public health, I didn't know a lot about epilepsy or seizures. So I came into the space not knowing a lot about it, but I had that public health background and I had that training background to offer to the foundation. So I was learning as I was going as well. And so I was like, wow, I didn't even know like any of this stuff, right? And so if I can learn it, you can
That is
too.
so true. LaQuisa, actually, hi Lily. Lily is in our chat. She's an ambassador. I actually spoke with Lily on Tuesday about her epilepsy journey. She is an epileptic.
Yeah,
And we were just talking about how when I first came here, or if people don't encounter epilepsy, they really do not know a lot about it. There's
yeah,
so many misconceptions out there. So you and I were in the same boat. Like I felt like I knew more about other health
yeah,
issues just because they're maybe more relevant or more in proximity to me in my circle. But I didn't
right.
really know anybody that had epilepsy or seizure disorders
Yeah.
at all. So I totally feel you. I've actually learned more from these chats, like these one-on-one chats, because I've told them in our chat, it's the Epilepsy Foundation, we move quick and we
Mhm,
get stuff done. But in
mhm,
that process, some things may be overlooked. And so I really appreciate where I can fill in these gaps of knowledge and be able to share that information. Because Lily's story was powerful, Laquisa. She
mhm,
remembers her first interaction with the Epilepsy Foundation after when she was diagnosed after having seizures.
mhm.
She received a pamphlet and information from the Epilepsy Foundation. Her family did when she was a kid.
Oh wow,
So
wow.
it's a lifelong support, and she's seen the impact that we can make. So just proof that we do offer great programs and services, and that's why I'm really happy to have LaQuisa here today because we are going to be talking about Seizure First Aid as well as some other health and programs that we offer at the Epilepsy Foundation. Many of you know if you're watching, we talk about Seizure First Aid often. We feel like it's a really great entry point into learning about epilepsy and to knowing the basics about epilepsy. Oh, Lily said she loves your earrings.
Thank you, Lily.
Lily has great style. She dyes her hair blue, like she's fierce, so I love it. So
Uh-huh.
take that as a compliment.
I will.
um so you guys know we talk about seizure first aid because it's a really easy way to learn the basics and to just make sure that your loved ones or even strangers around you that they're safe if they have a seizure and you're able to help them. So let's get to basics then. Let's get into it, Laquisa.
Yeah,
Why
I
is
want
it important that
to
people learn
know.
seizure first aid?
Yeah, I want to know who in the chat knows our three words, our three
Ooh.
uh, easy terms for doing seizure first aid. Anybody on the chat knows that?
All right, y'all
They,
better come through.
come on, Monique says she's been on here teaching you. So
The three S's, you guys. What are they?
S's, the three S's. Come on, Lily. I know you.
Anybody? I mean, we
Early,
might have a sleepy group this morning, different time zones.
early. gaming all night, watching videos all night.
Yep.
I understand. I
Doing
understand.
it for the cause, LaQuisa, raising money. I don't see any activity, but I promise you, some of them do know. They're maybe just being shy this
Okay.
morning.
Well, we'll go over it because if you like me, you need to be told things multiple times in
Yes.
order to remember. Then you're faced with it and it just kicks in, right? But it's important for everybody to learn seizure first aid because if you have a brain, you can have a seizure, right? And so we say all the time, anyone, anywhere can have a seizure. And the question is, would you know what to do if someone had a seizure? If you would you know what to tell someone if you had a seizure? Would you know what to tell them what to do? And so that's why it's vital that people know seizure first aid, just like any other first aid, general first aid practices. We know that we we know that 1 in 10 people will have a seizure in their lifetime. So think of any small group that you're in. For me, I'm a woman of faith or whatever. So I do small groups, in my church and stuff like that. So I have 10 people together, one might have a seizure.
Right.
You're in a classroom, with 10 people, one could have a seizure. So would you know what to do, right? I am actually streaming from the Middle East right now. And I'm friends with quite a few teachers. And so when I told them what I do, all of a sudden I get, oh wow, yeah, I did have a student, that had a seizure, and I didn't really know what to do. I called the administration, or I tried to find them, and sometimes all schools don't have school nurses either. So,
Right.
it's really important to know what to do if someone is going to have a seizure. You could be on public transportation, you could be at the gym working out, you can be taking a walk, you can be, your favorite sporting team, a basketball game, football game, or whatever. And so you just want to be equipped with the knowledge of knowing what to do. And so what I've learned, and I'm sure Monique has learned as well, by working at the foundation, there's so many different types of seizures, right? There's behaviors that people do that you wouldn't even attribute to a seizure.
Right.
So in our seizure first aid courses or educational material, we do take the time to show people the different type of seizures that people have, right? And for a person with epilepsy, they can have multiple different types of seizures, right? So it's a really complex issue, right? And so part of the trainings that we provide, we not only teach seizure first aid, but we want them to be able to recognize the seizure and distinguish that from any other type of health condition or issue, so that they know how to perform seizure first aid.
Right.
And so let's go over those 3 S's. Do you want to do
Yes.
that next? So
I
to
have
remind.
two things in the chat first.
Okay.
So Magma joined us. She's doing some charity streaming this November too. She says, I often tell people to think of how many people are usually at their family holiday gatherings. It's often more
That's,
than 10, and that statistic really shines there. So that is so true, especially with the holidays coming up.
that's,
Absolutely, that is more important than ever. And then Lily says, my mod group here on Twitch, so 13 of us, 3 of us had had seizures, and 2 are diagnosed epileptic. They were other the other persons were related to their heart. So yes, yeah. So I mean, you never in that small group, somebody can have a seizure, someone can be diagnosed with epilepsy. So
yeah,
it's so true.
yeah. Yeah, and I try to make it a point versus just saying, I work for the Epilepsy Foundation. I always follow that up, people who have reoccurrent seizures or multiple seizures. And then that's when the lights goes off like, what, a seizure? Oh yeah, I have seizures, or I know somebody who has seizures. And so
Right,
that,
framing it, huh? Just helps you kind
yeah,
of
yeah.
access
So
more.
I encourage, folks who, introduce epilepsy to always follow it up with talking about seizures, and don't just leave it at epilepsy.
I need to do that.
Um,
You just told
yeah,
me I need to do that.
yeah. So I tell you, I was at a training, and again, it was a church-related training, a faith-based related training, and we broke out into groups, right? And so there was a young lady I was in a group with, and I did tell you all that I'm, overseas, and so sometimes when they're, people are around Americans, they're intrigued, like, wow, I want to learn more about you, or, what do you do? And so I said, oh, I work for the Epilepsy Foundation. Nothing. And then I said, well, I create programs that teach people how to respond to seizures. Oh,
Light
and
bulb.
Yeah, and there was three of us. Out of the three of us, one of the young ladies, 22 years old, has been suffering with seizures for almost 2 years now, has been going to
Oh,
doctors, neurologists. Nobody can tell her what's going on with her body. So that's just another example of, just making sure make the connection with people, because a lot of people don't know what epilepsy is, but they are more familiar
with the
of
seizure.
the term and the condition, seizures or whatever. And so now I'm trying to help her navigate stuff in Kuwait, where I am overseas.
Yeah,
And so when you do raise money um, for this cause, I mean, we're really lucky and grateful, because they don't have the same level of resources and programs here. So I can't even help her how to navigate as much as I would be able in the States, right?
right.
We have 24/7 information and referral line. I gave her that information, but that's because we have those resources there in America, but she's not in America. So yes, the funds that you all contribute and donate to, they are really helping
They really
people
are.
get the information and the resources and the tools they needed. So it's just an example of the resources that we have in the States because of your contributions versus other places around the world.
Right, right. I'm sure that that disparity and that disconnect is pretty clear to you, obviously being overseas, something probably we
Yeah.
wouldn't experience. I know this is a little bit of a sidebar, but can you explain some of the differences of like what you're experiencing in Kuwait versus what might be available here, like, and kind of highlight that a little
Yeah.
bit?
So number one, there's no Epilepsy Foundation.
Right? Yes, yes. Are there any other like organizations that would serve that area?
They have a league, it's an organization called International League Against Epilepsy,
Okay.
which is an organization that works to advocate and do research on treatments and stuff like that. When I reached out to them a while ago to try to kind of see what they do, what they had going on, of course it was like we're in COVID, so we're not doing a whole lot. But I have not found like a organization even similar to the foundation that has offers
That's
trainings,
telling.
resources, information and referral line, some of a lot of the things that our core programs, I have not found yet at
Interesting.
all.
Okay. Wow. I wouldn't even think about that because I know, I feel like more of the people that we work with or that I've encountered are maybe like Europe, East Asia. They might just have a little bit more access.
Yeah,
So I would never have really thought about that. But I mean, that just tells you guys more how important it is that we're raising awareness and educating, right? Like, we need to make
yes.
sure that our communities in those areas have what they need to be supported. And
Like,
even though we're only, I mean, we're in America, we're a nonprofit in America, it doesn't mean that our impact is limited to the borders. We can
oh,
make a global
absolutely not.
impact, absolutely.
Absolutely not, because even with this young lady, where she, is really trying to navigate and get the resources that she needs, and also the family, because the family does not really understand what's going on
Oh,
either.
right.
Um, so, I linked her to our resources. I said, we have courses you can take to learn about it yourself, but also your family. And today she sent me a certificate. She took our Seizure First Aid
Oh,
Ready.
yay. I love
um,
that.
our courses do have an international reach. I didn't pull the data before this particular call, but there are people from all over the world that have taken our
I
online
love that.
courses. I've had an instructor who, works in the state. She works in academia, but she, is Kenya. She's from Kenya, so she took a trip to Kenya. She does some volunteer work at some clinics, and she had like 3 seizure first aid certification trainings in Kenya.
Wow, that's cool. I love to hear that. Yeah. I mean, we offer them in different languages, right?
We offer them in Spanish right now.
Spanish right
Yeah,
now. Yeah, yeah. You guys, we're a small but mighty team, so that is a huge feat. I've said
it
this
is.
before. I mean, you guys know I'm the only one doing Stream for Epilepsy. We are really, really taking on a lot because we are that passionate about our community. So that's awesome that we have that in Spanish. I actually didn't know that. Um,
Mhm.
So, going back to kind of more of the topic areas of today's discussion, just to kind of get going with chat. And for those of you that may have joined, I mean, we've been talking now for 20 minutes already.
Oh,
Amazing.
kind
We're talking with LaQuesia from the Epilepsy Foundation. She does everything with our programs, health and services, especially like Seizure First Aid. We've talked about this before many times. Even though y'all didn't come through and talk about Stay Safe Side, I will forgive you. But she is really behind the scenes making sure that our programs are up to snuff and also spreading awareness, raising, making sure that we're getting more and more people certified as that kind of entry level into learning more about epilepsy. So what other types of health programs do you oversee? Like, what is kind of your scope of work here at the Epilepsy Foundation? Because I think that'll help people maybe to understand all of the different things that you're working on here.
of. Yeah, it's interesting you asked that because when I came to the foundation, we had all these different programs for different target populations, like you said, law enforcement, first responders, child care, you name it. We tried to have a specific standalone program for. And so one of the things that we did was we took a step back and we said, okay, let's create one program that's consistent enough and that will be able to reach multiple people. And so we created the Seizure First Aid certification last year. It's the first of its kind in the nation. And last November we had a challenge to get 2,020 people certified, and we exceeded that or whatever. This is national. Did we say that this is National
Yeah, National
Epilepsy?
Epilepsy Awareness Month. Yep.
Yeah, yeah, yeah. So we're in November again. And so I help to create programs like that. So all the behind the scenes, where I get to work with a lot of talented people. It's not just me, from videographers to instructional designers to subject matter experts who, they live and breathe and they're practitioners in their field when it comes to epilepsy and seizures. And so I help to orchestrate and put everything together so that you can see the outward facing programs that you see. We are a national office, and so we have regional offices all over the country. We have affiliate offices, and so they in tune, we develop the programs and then we train their staff and volunteers on how to deliver those programs. So I also help to build those systems as well. So training instructors, I built an instructor site so they can access the material. So when they're ready to go out and disseminate the information, they have everything that they need. We'll talk about the epilepsy learning portal as well, because that's another huge
Yeah, so we
project
talked about with that with Kathleen last week too. Yeah.
that I led to develop. So Seizure First Aid. Now we have two ways that you can learn, two more formal ways that you can learn about Seizure First Aid. And that's number one through the certification program. Like we said, we are offering that in Spanish as well. And then we have the new Seizure First Aid Ready course where you can be Seizure First Aid ready in 30 minutes.
That's
And so I
awesome.
don't know if you all know about that. That launched in September, so just a few months ago, and it's doing great. Lots of people have
And
completed
30
that.
minutes is a good time to like commit to.
It is. It
Yeah.
is. It is. Yes, we want to. You want to. People are more interested in micro learning.
Yeah.
Easy. And so, when you're passionate about epilepsy and seizures, you want to tell them everything or whatever. So it becomes a
Yeah.
challenge. It becomes a huge challenge for me and the people that I work with because they want, no, we got to tell them this, we got to tell them that. It's like, no, let's tell them the basics. Let's make it interactive and engaging. And so this is our first animated course as well.
Oh.
Yeah, I'm really excited about that. We have some animations and some simulations and stuff like that. So when I came into the foundation, my goal was always to increase and take us higher, raise the bar when it comes to education and training. And so that's exactly what we're doing. So we're doing more interactive e-learning versus you just, watching a video and it's like, okay, I'm watching this video for an hour, that's it. Now I got to take a quiz. Now we're
Right.
like, no, we want you to be more engaged even when it's on demand, right?
Hmm.
And so we want you to be engaged and in tune with that learning process. So that's what we're doing now. And so yeah, so Seizure First Aid Ready. Another program that I oversee is our Seizure Safe Schools. And that's the most popular program.
Yes.
And the reason why it's most popular is because our advocacy team, and I always give credit, they've done such great work with getting bills and laws passed in 12 states now that require mandatory seizure first aid or epilepsy education.
So
And
important.
yeah, very important. So we're at the forefront of that. And sometimes our programs, your dollars, they're written into that legislation. And so that means that the schools come to us for to meet those needs, to meet those requirements. And so Kentucky was the first one who passed
Really?
a couple years ago. Texas has passed. We have Indiana, Illinois. So yeah, there's 12 states now, and there's still more states who are introducing bills. Well, next year are in the process of passing. So we had to build our capacity. So it's one thing, right, to advocate for something, we want something, but then you have to be ready, right? So
We
we
got to
had
write
to,
those bills
yeah,
and
you
make
got to
sure
be
people
ready.
can be trained. Yeah.
Yeah, because it's like, okay, you say you want people to get trained, so where is the training? Where is the system? What do we do? So that was my responsibility to make sure we have the systems and programs in place to meet the demand. So if you think about Texas, that's one of the largest states in
Yeah.
America, next to
Lots of
California.
schools.
There's over 700,000 school personnel in Texas. So
Wow.
it's my responsibility to make sure they at least have access to the information. Now, if they choose to get it somewhere else, depending on the department, but it's our job at the foundation to make sure they have access to meet their now mandate for their job to do their job.
Right.
And so, I'm sure you all might have some examples of like being in school and your teacher not knowing what to do,
Yeah.
or your bus driver
Actually,
what to do, or
we have
or
we have an ambassador. Her name is Emily. She was talking on Twitter actually, just talking about how at her school, their school nurse was unwilling to give her her rescue medication because it was entered in rectally, and refused to help her in that regard. So, I mean, that just shows you the importance of even the school nurse, right? All those people need to be educated to help people like her.
yes, yes. I mean, just last year we trained or over 170,000 people took
That's
our
insane.
personnel.
Did you guys hear
So
that? Did you hear that? 170,000 people
yes,
were trained
over,
in
over.
over and trained in seizure safe schools for seizure first aid. That's amazing.
Yeah. And so, so sometimes this is, the first, the first introduction into the foundation for people, right?
Right, right.
Okay, I gotta take another required training. Okay, who do I take this training?
Yeah.
Oh, the Epilepsy Foundation. Oh, the Epilepsy Foundation. Oh, what is that? What are they about? So my programs are kind of the introduction for a lot of people to the foundation and into epilepsy. So I'm really excited about that. August, right? August is one of our months that we see the highest numbers for school personnel. Over 50,000 people took one of our school personnel
Wow.
courses in the month of August. So
Just one
it,
month alone.
it's a huge forward front facing program that we're really
Yeah.
proud of.
Yeah, guys, see, this is what your dollars, this is what your support means. It's
Mhm.
actionable. It's actually going into the community, helping with preventative care, helping with and to ensure that our kids are safe. And other
Yes,
people also in the school. Like this is not just for kids, right? Adults can have seizures too in the school setting. So
absolutely.
it's really and it's obviously going beyond those school settings too, because these people have are not armed with this information in their community too. So it's really a far-reaching thing. What a cool accomplishment, LaQuesia.
Thank you. And then you mentioned school nurses. So we have a separate program for school nurses, and it's about a 3-hour training program
Right.
because we want them to know how to
And
manage,
they should. Yeah.
like you brought up that the great example of that. So we have courses for school nurses as well. So they can either take the school personnel, the general course, or they can take we prefer them to take the school nurse, the ones that are more targeted for school nurses, because it goes into like a lot of the treatments, the management, the delegation, and all of that stuff. we go into for the school nurse training. So
Right, right. That makes
rescue
sense.
medication, standalone training on rescue medication for nurses or anybody, any other professional or person who wants more detailed, in-depth information. So we go really deep in the trainings, but we also have the basics as well.
Right.
For those of us who just want to know the
Yeah.
basics.
So these courses and everything are found on the learning portal, right? So I put that link in the chat.
Yeah,
Did you
learn
want to
that.
just kind of explain? I mean, it's really easy to sign up, obviously. Kind of what's all involved with that?
Yeah, so the epilepsy learning portal. So now, if
And I'll
you've
put that
ever,
link back in, guys. So I know it's been some time since I put it in. Sorry,
so
go
I
ahead.
know you all have taken an online course, a class, especially during the pandemic, right? Everybody was pushed to take a course, a class, a training, something online, right? And so, you might have had some type of mandatory training at your job. So, like I remember, working at a university, we had mandatory security trainings, mandatory IT training, So typically, you have to go into a system, right, to take those types of trainings. The Epilepsy Learning Portal is the foundation's one-stop shop to access all our online and training courses about epilepsy and seizure. So more of the formal things. And so we use this system to deliver those trainings to you, right? The online, the learning portal is a learning management system. So if you hear the word learning management system or LMS for short, it's our epilepsy learning portal. That's just
Right,
what we called it.
right,
But most people, learning management, if you have a learning management system or a training system, that's what it is.
right,
And so it tracks students' progress as they're taking trainings. It keeps the records of training. It helps us evaluate our training so that we can make improvements as needed. And also, once you take a training, you have a way to track your own training, your certificates of completion, and stuff like that. And so that's what the Epilepsy Learning Portal is. It's where we house and maintain our online courses and also some other educational material.
right, right. Yeah, it's a great resource, you guys. I'd recommend checking it out. If somebody doesn't have the time to do this, what other
Mhm.
ways can they learn about the basics?
Well, I'll tell you, 200,000 people took the time to do it just in January alone.
LaQuisa's saying just do it.
No, but so we launched this in January and we've already had over 200,000 accounts
That's
on the
crazy.
system. So I'm really excited about that because
Yeah,
that
as
was
you should be.
one of the programs that I had to create and launch, right?
Yeah.
There are multiple other ways to learn about epilepsy and seizures. Even on the portal, I've added some educational videos or shorter videos. You
Oh,
don't have
that's
to
nice. Little tidbits.
Yeah, you don't have to have an account and enroll into a course. It's just kind of a list of those. But also on the Epilepsy Foundation website, we have tons of information. You might
We
even get
do.
lost in the information.
I
There's
was
so
gonna
much.
say, you guys, I apologize. I've said this before. We're redesigning our website, so just bear with us, okay?
Yeah, but still, it's a great
It
search.
still has a
search.
lot of information.
Yeah, if you just go in there and search for what you're looking
Hmm.
for, you'll
It'll
get it.
come
But if
up.
Yeah. So
Yep.
don't worry. Also YouTube, we have a lot
Yes,
of
we do.
information on our YouTube page as well. We do a lot of other webinars, and typically those are pre-recorded and they're added to our website and our YouTube page. There's Facebook lives that the foundation does. I'm not really responsible for those, so there's a lot of different ways that you can become educated. But most importantly, check your local office. Wherever state you're in, whatever region you're in, connect to the local office, see what they're doing locally to get involved. They do walks, they do other campaigns and initiatives to help people get educated about
Right.
epilepsy. Mhm.
Yeah, in your community, right? Obviously, we all want to make an impact in our communities, but the cool part about the Epilepsy Foundation, obviously, is that regardless of where you are, we have ways to kind of access you or to reach you,
Yeah.
which is why the learning portal and other things that LaQuisa works on are so important because they are reaching everybody where they are. Justin actually has a question. Also, hello, Justin. Um,
I
do you know if there is legislation in Ohio? I work in government and may be able to help.
Yeah, you should check. You should check it out. Check out
Let's.
Yeah.
Justin, why don't do you mind just shooting me an email and I can connect you with our team in Ohio? I would love to connect you and they can give you more of the kind of updated progress. Obviously, advocacy and legislation efforts are very complicated. There's so many steps in it, so I want to make sure I'm getting you to the right people and not
Yeah.
putting my foot in my mouth. So Justin,
I
if
can
you don't mind emailing me, that'd be super helpful.
Yeah, I have the list of states up that currently have already passed
Yes.
legislation. New Jersey, Washington State, Alabama, Oklahoma, Colorado, Indiana, Texas, Nebraska, Minnesota, Kentucky, Illinois, and Virginia.
Right.
I don't have the list of the ones that are introducing bills or
Exactly.
further along, but we can definitely get that to you.
Yeah, so if you email me, Justin, or I can try to DM you after this, I'd be happy to make sure we can connect. That's awesome. Yes, thank you. Hey, Ash, how's it going? Good morning. We're here with LaQuesia from the Epilepsy Foundation talking about Seizure First Aid. I really appreciate you guys joining in today. Y'all are the best, the true MVPs. Um, all right, LaQuesia. So, how has the Epilepsy Foundation, made an impact on keeping people with epilepsy safe?
Oh, wow, that's a great question. Well, part of what I do is to educate people on how to keep them safe, right?
Hmm.
We have so many different programs at the foundation. And we receive, and I think I mentioned that we receive funding from different areas, from donations. Thank you
Right.
for your donations. Other sponsors, but the work that I do is primarily funded through the Centers for Disease Control and Prevention (CDC), and we are actually just now going into a new cooperative agreement with the CDC. So we got funded for another 5 years. We're so excited about
Incredible.
that.
You guys have no
Yeah,
idea how much work goes into that. It's insane. It is there are obviously so many worthy organizations vying for that support from the CDC. So just know that that is a huge win for the Epilepsy Foundation and what we do. Yes, Ash said, woohoo, 5 more years. Yes, 5 more years
five
of progress. It's amazing.
Yes, 5 more years. And so we're excited because like Monique said, it's a competitive process. So we have to apply every 5 years, just like everybody else. And so they are pleased with our work. They want us to continue to expand our work because we are doing a lot of great work. We're making, great inroads and impacts on the lives of people with epilepsy and their families. And so some of the things that we'll be doing is the public health education and training team is we'll be expanding the work that we're currently doing to make sure
Oh,
that we're reaching
exciting.
who we haven't reached or we need to do a better job at reaching. So we're looking at different racial and ethnic communities,
Hmm.
underserved communities, hard to reach communities, people in rural areas, to make sure we develop strategies and partner with organizations who know how to really do this work because they do it all the time, to do the work. And so we have different initiatives in play. And so earlier we talked about that we do offer our current instructor led, which is a live Zoom webinar, right? Seizure First Aid certification. We offer that in Spanish. So what we're going to do to what I said, I'm always trying to, raise the
Yes,
bar.
I love it.
We're doing as part of this funding is we're creating a whole new Spanish program. And so it's
Oh,
not
great.
just translating what we already have into Spanish, but we're going to make sure it's culturally competent and culturally relevant.
That's
And
so
so that
important.
means the videos, that means the images, that means the scenarios need to relate and be relevant to, Hispanics and Latinos. And so
Right.
that's one of the things that we're going to be working on this year, well, next year, as part of our new cooperative agreement so that we can reach more, Hispanics because they're disproportionately affected by epilepsy as
Right,
well.
right.
So that's a huge undertaking. We're really excited about that. And not only that, guess what? That program, as well as some others, will be delivered through a Spanish epilepsy learning portal.
Oh, cool.
Yes. So right now, if you only speak Spanish, it might be a little difficult to navigate, our site and our materials. Yeah, we have Google Translate and you can kind of translate some things,
Right.
but everything doesn't automatically translate. And so we are going to invest resources in developing a Spanish sight. So everything you see
So
will be in
cool.
space. So we're really excited about that.
Yeah, wow. So that's kind of like your next step is really reaching where
Yeah,
audience is, which is really
yeah,
cool.
yeah, yeah. We
Um, yeah.
mhm.
So obviously that is a huge accomplishment in and of itself, just kind of looking ahead to the future, because of course you're going to get it done. You've gotten so much done up until now. But I'd love to hear more about kind of your accomplishments and what are you kind of most proud of? Obviously, you've alluded to some of that earlier, but I'd love to hear your thoughts about it.
Yeah, yeah. So yeah, we talked about the things that I'm most proud of, but I'll tell you a little bit more insight of why. With the epilepsy learning portal, this was a huge undertaking. We had a learning management system. It wasn't the best. It really wasn't good at all. But we were still providing access to our materials. So
At
it
the
was kind of
minimum, yeah.
yeah. So when I came on board, it was like, LaQuesia, we need a new system. We don't even like to promote this one, to be honest with you. We need a new system. We knew that, states were in the process of passing legislation. And we just need
Right.
to, beef up our systems and our capacity to meet the need. And so I'm working on this, right? Working on developing a new system. I'm working with a vendor. We're designing the site, getting things together. Texas passed their law, broke the system,
Oh man.
crashed the system. And I'm like, no,
Oh.
no, no. So we're scrambling, trying to figure out, oh my God, we got to. So that's why I'm so proud of the Epilepsy Learning Portal because I don't have to worry about the system
No.
crashing. I don't have to,
At least
and
it's
it's
out of your control if it does, right? Like it's some other worldly
yeah,
event.
exactly. So, but I have the confidence and trust that this system
Right.
can really, meet the needs of people without all the stuff that they had to go through. And not only that, that vendor that I was working with at the time in the process of building the new system kind of backed out of the contract. And so I had to start all over from scratch. And
Shut up.
yeah, so that's why I said I am proud.
Oh, labor of love. Holy cow. I would have,
Yeah,
I mean, I'm sure
yes.
some expletives were expressed. Holy cow.
Ooh, yeah, yeah, yeah. So that's why I say I'm really proud of that accomplishment because
Yeah.
it was a lot of hard work, and I could have gave up on it. Like, you know what, put somebody else. I'm over it, But no, I'm like, no, we're gonna get this done, and we're gonna do it well.
It is a
And
great website, I will say. It's really easy to navigate and it also looks good, right? It looks
so,
modern. So I just put it in the chat again, you guys. We posted a couple of times, but this is where all the trainings are. This is all that hard work that LaQuisa was putting into it. And it's a really important resource for us to be able to access people where they are.
yeah,
Which can they access this in Kuwait?
absolutely,
They
yeah. The
can?
lady,
Because
the
I know
lady
that
that
there are some fire blocker for like U.S.
yeah,
sites
I mean, it
versus
depends on the country if they
right.
block certain
But in
content from certain.
Kuwait, they could.
Yeah, yeah.
It's
The
just
I
not. What is the primary language in Kuwait?
Arabic, Arabic.
Arabic. Arabic. Okay. Obviously, it's not in Arabic, but Google Translate, like you said.
Yeah, but most people speak English though.
Right. Right. Right.
Yeah, the lady that I told you I connected with
Yeah.
recently, 22-year-old, yeah, she's in Kuwait. She sent me a screenshot. She had a
I love
certificate.
that. Oh, that's right.
Yeah,
You did say that. You did say that. Yeah. Yeah.
yeah,
That's awesome. Yeah. I mean, I always think about that. Like, I can like barely speak English. It's really a travesty. That's a sidebar, but all Americans should have to speak another language, right?
I
Um,
know. She
oh,
struggled
so
with the
Ash says, thanks so much, LaQuisa. My wife was able to get certified. It came in handy for her at work.
absolutely. That's great. That's great. We hear, and that's what keeps me going, to be honest. I mean,
I was
it
gonna
is,
ask you that because you've obviously had your fair share of
yeah.
challenges these past three
It's
years only.
Yeah, it's a lot, but when I hear those, that type of feedback, the testimonials. I mean, we were on a session for the American Public Health Association, which is a huge conference
Right.
because the public health community is huge. So we offered our certification program, and there was somebody in the chat. And people, my son died recently,
Oh,
of a seizure. Thank you so much for this information. I've started my own nonprofit. I'm going to make sure, so you get those, and it's like, okay, look, Lisa, keep doing what you're doing,
yeah.
So yeah, so thank you so much for sharing that.
Yeah. And Ash actually is he is also an epileptic. So
Mhm.
that information really obviously has helped his peers too.
Mhm.
Hey, Riley Berries. Hey, Kirsty. How are you guys doing? Thank you for jumping in. Kirsty, I've not seen your name before, so I think you're new here, but
Hi,
welcome.
Christy.
We're talking to LaQuesia from the Epilepsy Foundation about Seizure First Aid.
Right.
And also just, she's in Kuwait right now, so I was just prying for a little bit more information. I'm a little bit ignorant on Kuwait culture and what's available, so getting educated. But feel free to ask any questions. We have about 15 minutes left of this conversation. LaQuisa, I want to first just say you are probably one of my favorite interviews so far.
Oh, wow. Okay.
You're so engaging. You have so much information to offer. I feel like our chat also is feeling that too. I would love for you to come back at a later date as well and talk about some of the updates. And I know that there's a lot in the pipeline. There's always a lot going on here at the
Yeah.
Epilepsy Foundation. But I'd love to have you back on sometime, and we can talk more about this. Or maybe we conduct Seizure First Aid.
Yeah, why not?
I mean,
Why not?
why
Let's
not,
do
right?
it.
So you guys, we'll
Because
talk about that
clearly,
offline. But
clearly some people need a reminder. They couldn't tell us what the three S's were, right?
yeah, like come on, you guys, you really embarrassed me. What? Let's put up first aid again. Stay safe side, right? Stay safe
Stay
side.
safe side.
Those are the
Stay
three
safe side.
S's. Keeping
Yeah.
people safe. Seizure first aid. So you talked a little bit about what's next. Obviously, you said targeting lower income and or disproportionate areas that aren't getting the access to the resources or support that they need. Obviously expanding different languages, making things more accessible. Accessibility is a really important piece to our community here. Making gaming accessible, reducing flashes on games, photosensitivity, even sound sensitivity. Obviously, we know there are tons of triggers with epilepsy,
Yeah.
and so I'd love to hear more about, what's kind of next in terms of like accessibility and other things that you're doing to reach these different audiences.
Yeah, sure. So when we design our courses, we keep accessibility in mind.
Love that.
There's actually some things that we would like to do that we don't do because we know that it will cause, some accessibility problems. When you look at interactive e-learning, when you want people to drag things and move things and stuff like that. But we do, have software that has, different accessibility components built in so that we are meeting the needs. And also, if you're funded by the federal government, you have to, follow those rules and making sure that your material is accessible. We have captions on our content. We have transcripts if people request them.
That's perfect.
For our live sessions where you're taking the certification live, if they, we let people, we ask people to tell us ahead of time if you need any special accommodations so that we can provide that for you. So we keep in mind accessibility. One
Right.
thing that I did not mention, Monique, like, so right now, if you want to get certified, you have to do it through a live session, and it's instructor
Right.
led. But guess what's coming out this month?
I
Uh,
don't know. Please tell me.
on-demand version of Seizure First Aid. So
Love
that
it.
means you get certified anywhere at any time because it's on
In
demand.
30 minutes, right?
You're gaming to 1, 2 in the morning. You say, "Oh yeah, I want to be certified." At 3 in the morning, you can go ahead and start that
Do it
training if you want.
online. Yeah. But you're already online.
So we're excited about that because
Yeah.
again, that's going to expand the reach because we're not able to offer the live sessions at
Right.
20 times a
Right.
day
And
or
that
50.
obviously that's reaching people different time zones too, right? It makes sense. Yeah. I love
So
that.
that's
I love the piece on accessibility too, because I talk about how important accessibility is, but epilepsy.com is not the most accessible website. And so
mm,
I always acknowledge it. I'm like, we're working on that too. Like we also
yeah,
need to be more accessible because we can't be sitting here saying this is what we should be doing when we're not doing it ourselves. So keep us accountable, you guys. If you also see
yeah,
anything or if there's anything out
yeah.
there, like let
Even
us
with the
know.
courses, even with the trainings
Yes.
and courses, if you see something, say, LaQuisa, hey,
LaQuisa.
okay, I'll work on that. Yeah, because we want to make it engaging. We
Yep.
want people not just to sit and watch. We want them to be able to, engage the content. But we have to keep in mind that's a barrier for people as well. So yeah, let us know if there's something that we can do to make our programs, even engaging with
Yes.
a course or content, more
We really
accessible.
take your feedback seriously, you guys. I've worked for other health organizations. Obviously, LaQuesia has. Not all of them are as willing to change. So that's definitely a really huge positive about what we do at the Epilepsy Foundation. I feel like we're much more flexible and we really are listening to our community, which is really
Actually,
cool.
we listen a lot. I
A
mean,
lot.
so
Like
I'm gonna.
almost to a fault where like I sometimes internalize it personally, because I just want to make sure everybody gets what they need. But obviously too, we are limited in what we can do sometimes, and we try our best. But it's always great to get that
We get a lot
feedback
of
because it's something
requests.
for us to look for, right? Like you said, always trying to up the game. That's really what we're trying to do. Oh,
We get
Kirsty,
a
you have epilepsy as well? Okay. How did you
Hi,
find
Chris.
our chat? Did you find it in search? Sorry, Kirsty's been chatting because this is her first time
Christy, where
here.
you from? Christy,
Yeah,
where are you?
Kirsty, where are you from? Kirsty has epilepsy, and she was curious if everybody here on this chat today and or in the video has epilepsy. So I told her that we don't necessarily have epilepsy, but we're working to support it at the Epilepsy Foundation.
Yes, we advocate, we
Yep.
provide resources and programs, not only to help people with epilepsy and their families, but also to keep you safe.
Yes.
You might have a seizure in public or, with your family.
Yeah.
Hmm.
Mr. Sketty, hi. Oh, that's okay. Mr. Sketty is going to be on a chat with me tomorrow.
Oh, wow.
He
I'm
also
just
has
talking.
epilepsy. Yeah, thank you for the follow, and I'm looking forward to chatting with you tomorrow too about your journey with epilepsy. For your reference, Mr. Sketty, hopefully I'm saying that right. I don't. It's Mrsketi.
I see. When I
Yeah,
look down, I'm looking down at my phone to see
yeah,
the chat.
yeah. I figured you
I keep
were.
looking
Yeah.
down.
Um, we're talking with. I am. I'm saying it right. Okay, good, good, good. It's always my fear to like misidentify somebody. But
So
we're
what y'all
talking.
tomorrow, Mr. Sketty? What you gonna be talking about tomorrow?
We're gonna be. He actually has epilepsy. Um,
Okay.
and he's a pretty popular streamer on Twitch. We really appreciate him giving us the time. He puts together amazing music.
Oh,
I should actually share his channel. One of
oh,
our followers. Oh, did you see that in the chat? He said he has.
PNES, is it?
He said he has simple psychic partial seizures.
Okay, okay, okay.
So I'll put his channel in the chat. You guys definitely give him a follow, um,
Yeah.
especially in advance of our chat tomorrow with him.
Has,
Incredible
has
music.
is this the only epilepsy community on Twitch?
This, I think that we are actually one of the only ones that is like the actual organization, right, on
Okay,
Twitch. There are so many obviously worthy charities out there regarding epilepsy. Some of
yeah.
them do have like different fundraising arms and different, like they're in the same spaces where we exist in terms of the fundraising pages and stuff like that. But I don't know if they have their own channels necessarily. I haven't really
Oh,
seen that much. So again, we're trying to do something different and make sure we're reaching more people. Yeah, of
yeah.
course, Mr. Sketty. I'm really looking forward to talking with you tomorrow. Oh, hey, Darth Rips. How's it going?
Hi.
Wow, it is popping here in the last 8 minutes, Louisa.
Hi,
You guys,
everybody. Welcome,
for
welcome.
those of you just joining, LaQuisa is joining us from Kuwait. She works for the Epilepsy Foundation. She does everything with our health program, Seizure First Aid. Her epilepsy learning portal is such a big piece of her work, getting training, information to people that need it, professionals, educators, first responders, what have you.
Yeah,
She is really fantastic and behind a lot of our really important health programs at the foundation. So we are very lucky to have her. And she has a
here.
incredible track record with health and nonprofit work. We talked about that at the top of the video. I'll make sure to clip some of this too, and I've already invited her back because it was so great. So that is my word vomit of what just happened in the past 50 minutes. Oh, Kirsty, did you see Kirsty's comment?
You forgot to mention that early on we asked people about Seizure First Aid, and
Yeah.
people couldn't put that in the
And
chat.
LaQuisa is going to
So
keep throwing me under the bus for that. And that's fine. I will take it. I'll take it. You guys, the three S's. Next time I ask, I hope you know it's stay safe side. That's what you need to do. If somebody's having a seizure, stay with them, make sure they're safe, and put them on their side.
There
What
you
is the limit for when you should actually be calling 911 again?
go. Five,
It's
five
five
minutes.
minutes. That's what I thought. Yeah, because
If
that
it
was
lasts longer than 5 minutes, you call 911. If the person does, if you know the person and they don't return to like their usual state,
then
you
called.
call
Yeah,
911. But there are some other instances, like if the person is pregnant, you want to call 911.
right,
If there's some type of injury or some type of other type of illness or whatever, you just want to go ahead and call 911. Yeah.
right. Yeah, and that's stuff you can learn in Seizure First Aid. Basics, right?
It's the first time seizure, if you know, but these are some of these things you have to already know the person,
Yes,
right?
right,
You can't be in public, and you
right.
don't know if the person's first time having a seizure or not. So you have to,
Err
try
on the
to
side
ask.
of caution. Yeah.
Yeah, yeah. So yep.
Did you
Hmm.
ever read Tawanna's story from EF?
I love her story. I was actually going to mention that because when you said, why, the impact that we're making
That
and,
is a perfect
why we do
example.
what we do,
Why don't
it's
you
such a
do you
powerful,
remember it?
somewhat, yeah,
Yeah.
I can
Why don't we
try.
share that as like a last reminder about, what it is we're doing and the actual real world impact it has had with Seizure First Aid?
Yeah, so our colleague Tawanna, she works for the Epilepsy Foundation. I can't remember what Tawanna's title is.
Oh,
She's director.
she's like she just knows
Project,
everything. She does
yeah, she
everything.
does. Yeah. She's a, I know she's a project manager, but she project manages a lot of things, a lot of our events, activities and stuff like that. But anyways, when you work, when you're in the space, you kind of think whatever you might not. So let me just do. She took the Seizure First Aid certification course, right? So she took the Seizure First Aid certification course, and then I don't know how soon after she was at the grocery store and somebody has a seizure. And I think, of course, people were panicking, didn't know what to do or whatever. And she was able to kind of step in calmly because she just had, been trained on seizure first aid and help and intervene in that situation. And I'm not doing the story justice, but it's really powerful how she actually wrote up like a success story and why it's
Yes.
so important for everybody to know seizure first aid because she just in the grocery store as she normally would be, and someone has a seizure, and people didn't know what to do. The employees at the grocery store didn't know what to do.
Nope.
I think somebody may have attempted to help, and they were doing something
Wrong.
incorrectly.
Yes.
Yeah, so she was able to, help out and intervene in that way. Like, no, you should do this or whatever. So it was a really great story. It was a really
Right.
great.
It was everything that the misconceptions played out in front of Tawanna's eyes, and
Yeah,
she was
yeah.
able to address it with confidence and know exactly what to do for this stranger in this grocery store. I have the story up, LaQuisa. So it was other team
Thank
members were yelling to grab the first aid kit. When they brought the kit, someone took a pencil out of the box and wanted to place it in the man's mouth. I immediately
you.
said, "No, do not place anything in his mouth. Keep him on his side, stay with him, and keep him safe." I asked the folks who were crowding around to move back and give them space. See, I mean,
Yeah.
this is real life that happened for our colleague. Oh, Ash. Ash has a question. Is
Mhm.
there plans for a first aid video more geared toward children? My children have knowledge because of me, but was wondering since I know a lot of those with epilepsy have kids. It's a great question.
Yeah, we actually have video for you. Take charge. Elena, I think is the animated character story.
Oh, it has an
Um,
animated character. Her name's Elena.
yeah, I think her
That's
name is
cute.
Elena. So we'll try to find it and put it in the chat for you.
Yeah, yeah.
Uh,
Let's put it in the chat. It would be under seizure first aid, right?
no, it's
No.
not on that page. We might
Okay.
have to see it later. Let me see if I can find it. But yeah, we do have a classroom education program that we're revamping, but it's
Oh,
available, and
cool.
that came with age appropriate videos.
Do you know when that would be coming?
It's no, so we have it now. We're just revamping.
Oh, right. I
Yeah,
mean the revamp.
the revamp is next year.
Next year. Okay, cool.
Next
Maybe
year.
we could touch base on that then, too, at a later date. I'd love to see that. Oh,
Yeah.
Lily says, Like I mostly have focal seizures and only have tonic-clonic once every year to 18 months, sometimes longer between some of my family really panics when I do. Yeah. We were
Mm-hmm.
talking about that with Lily on Tuesday too. You know, her family is always worried and always maybe thinks that they need to call 911 right away.
Yeah.
Obviously, they want to make sure she's okay.
Have they taken any of the trainings or courses, or just watched any of the educational
I'm
material?
not sure, Lily. Have your parents done seizure first aid? Obviously, they've been acutely aware of your condition since you were a kid, but curious if other family members or anybody else has. Yes, Ash, that was a great question. We have it. We will find the link and we'll be able to get that information to you. But obviously, seizure safe schools and those pieces, there are pieces where we go into classrooms and we educate. So that is a program of ours that we do as well. But
Yeah.
like you said, it's not necessarily as easy on demand. Yeah, I can DM it to you in Discord. I'll do that. I'll get the link from
Yeah,
LaQuesia
and
after
link up
this.
with your local, like if there's a local office in your
Yes.
area, one to.
Yeah, and in Wisconsin, I know it's an affiliate. I don't want to get into the complications of that. Um,
Yeah.
but I will help you, Ash. I will get that. Lily said my family haven't though they have been somewhat familiar with seizures and epilepsy before I ever had it. Oh yes. So Lily alluded to this in our chat with me on Tuesday. Her uncle's partner had epilepsy. I think I'm saying that right. So they were familiar with what to do. Her uncle knew what to actually do for her when she had hers, which was lucky because I'm not.
Oh,
I was saying if my family if I had had a seizure, I don't think they would have known what to do.
yeah, yeah. Mine's
Yeah,
either.
yeah. I still think that they would. Yeah, I mean, and some of our colleagues, at the Epilepsy Foundation, some of them do have epilepsy, some of them do have seizures. So, and we also, some of us have witnessed it on a Zoom call or things like that. So, um, yeah, familiarity is good, but definitely seizure first aid is kind of the next step that can really make you an expert on what to do in that situation.
I found it. I'm gonna put it in.
Oh, cool. So, Ash,
I'm
you
gonna put
found it.
it in, and then
Yeah,
we can put it.
yeah, you can
Okay.
send it to me and then I'll put it in the chat.
I think or not. I can't
You
remember.
could put it in Zoom too if you'd like. We're doing this on
That's
Zoom. Super high tech, you guys. Oh,
yeah.
Percy, of course. I would love. Please follow our accounts. Thank you. They're small but mighty. It's all me and our social team. Yeah, your former's partner. Yep, uncle's partner. Just
Okay.
putting them all up there. Take a peek. Oh, perfect. So I'm gonna put that link there in the chat here. Oh, it's YouTube. Awesome.
Yep.
Yes, we have a lot of resources on YouTube. So Ash, that YouTube link is for the children training. Oh my God! Speak. I cannot talk.
This video was created for our Take Charge program, and it's K through 5.
Perfect. All right, K
And so
through
it's
five.
only a couple of minutes long. It's a really good video.
Awesome. Well, LaQuisa, a full hour gone.
Wow, I made
61
it through.
minutes up, 61 down, right?
Yeah,
You nailed
yeah.
this. I really thank you for taking the time out. What time is it in Kuwait right now?
6 p.m.
Wow. Oh my gosh. Okay. Thank you. We are eating into her dinner time. You guys, thank you so much for being so active in the chat, for asking really thoughtful, great questions, for
Yes,
really
thank
just
you.
being engaged and supporting our community. Obviously, I would say LaQuisa and I seem a little very much like kindred spirits. We're very passionate about the communities. It's your stories, it's your dedication, and your passion to what we do that also fuels us. It makes us all worth it. The stress of it all, of working in public health, worth it. So, thank you so much for all that you guys do. And as a reminder, it is National Epilepsy Awareness Month. November
Yeah,
is a big month for us. 3.4 million Americans have epilepsy, and we are doing so much at the Epilepsy Foundation to raise awareness this month. So, feel free to check it out and get involved if you'd like to do a charity stream. If you want to just participate in other activities we have going on, there's so much going on in November. It's a big month for us. Please just check it out. I just dropped the link for National Epilepsy Awareness Month in our chat. If you have any further questions for LaQuisa or anybody else that's ever on Let's Talk About Epilepsy, feel free to email me or join our Discord, and I am happy to direct them to the appropriate person. Because again, I am not a physician. I learn about a lot of this stuff with you guys, um, and so we're learning it in real time together, and I'm happy to help get the information to you because we have so many incredible people like LaQuisa who are experts on their topic areas and such great resources. So, LaQuisa, do you have any final words or thoughts before you head out and eat dinner?
Yeah, I just want to say thank you so much for taking the time to, join in on the chat, listen to what we have to say. For those of you who have been supporting the foundation, you're learning about where those dollars go, how we put them into action to support the epilepsy community and their families. And again, yeah, this is Epilepsy Awareness Month. And so make sure you do your part to teach somebody about Seizure First
Yep.
Aid, have
The three
instructor
S's, you guys, please.
that we we have instructor-led sessions going on for Seizure First Aid all month long, including two Spanish sessions. So you can go to epilepsy.com/first aid and you can see the dates of those live sessions.
Yep.
If you don't want to take a live session, we have the on-demand trainings for you where you can, like I said, take those anywhere, anytime. And also, we have a great volunteer community,
We do.
ambassadors. We would love to see you all there. They help us, champion and spread awareness about our programs and the work that we're doing. So we just appreciate your time today. And yes, please feel free to reach out to me or someone on the training team, and we'll be more than willing to help you.
I couldn't have said it better myself. Yes. Thank you guys for all that you do. Thank you for being here today. Our next chat is tomorrow with Mr. Sketty himself, the man, the myth, the legend in the chat. We're going to be talking about his journey with epilepsy and also just getting to know each other because we actually have never talked before, Sketty and I, besides via DMs. So I'm
Oh,
looking forward to actually meeting him and talking more about it. But again, if you ever have questions, reach out. Let me know. Again, Monique, LaQuisa, thank you so much again for all that you do, and we'll see you guys again tomorrow afternoon. Looking forward to it. I hope you guys
oh,
have a great rest of your day.
thanks for inviting me,
Bye,
Monique.
everybody.